far as the causes go, I find that a lot of these athletes have a very tight posterior capsule.
Yeah.
Okay? And that could be one of the kind of prerequisites for getting the slap tear, because their posterior capsule is so tight and it's putting more pressure on the biceps tendon. And then when they're doing these repetitive motions, it just keeps grinding away right on top of that labor.
Yeah, definitely. So they have that, a lot of overhead athletes have water polo, everything you can name it's overhead, but it seems like it's also somehow protective though too in baseball players, because they still have the same arc of motion. So they lost part of their range, but then they gain extra range this way, so it's still that same arc.
Right. Isn't the human body amazing?
Yeah.
Right? It really is. It is. These compensations, you know.
Yeah.
I also see that even though the inferior glenohumeral ligament complex, which is responsible for a big factor of stability in the joint, is not disrupted, there's more, when people get a slap tear, there's more strain on that, and they have a certain sense of instability, you know. And even though there's no actual Bankart, there's no actual disruption of the stability factors, they still have that instability because there's more strain on that area when the slap is present.
Yeah. Do you address that ligament surgically?
Only if it's torn, but I find that if I stabilize the slap tear, the superior labrum, and we repair this labrum, and the biceps anchor is stable. The big factor to know if it's a good stable repair is not so much, yeah, you want a nice secure repair, but you want to make sure the biceps is stable. So you do we do an intraoperative peel off before and after to see if the biceps is stable. And when I see that, I feel like the shoulder becomes much more stable, and you don't need to address a Bankart, because often isn't there. It's unstable because of the slap. You don't have to proceed. Obviously, if there's a Bankart, we repair it.